Hi, this is Dr. Bueller, and we're going to talk today about pain pathways and chronic pain states and why certain medications work for some chronic pain states and not for others. So pain is actually the most common clinical complaint. That might be due to different variations, but the reason that someone comes into the doctor is usually because they're experiencing some kind of pain. No one likes pain, but often in our society we have an idea that if you're strong, you just work through pain. However, chronic pain actually makes physical changes that increase cancer risk, increase heart disease risk, and various other physical ailments. We find that people in chronic pain have difficulties in their relationships. They have a higher divorce rate. They have a higher rate of losing jobs and not being able to work certain jobs. So people in chronic pain usually end up having lower economic levels. So when we kind of look at pain as, oh, just be strong, just tough through it, we're not really looking at the fact that this is going to have multiple different consequences in our lives. We all know about acute pain. Acute pain is any type of pain that's happening while you're having an injury to your body. So you break your leg, that's acute pain. Even if you have, say, lower back pain because you have a disc that is bulging, you may have that pain for a long time, but it's because there's actually a problem. And that problem is lasting a long time. But it's acute pain because the pain is actually from a physical injury. When you get chronic pain, that's occurring after the injury is healed. And so there's no real reason for your body to be telling you that you have pain. It's not trying to protect you from anything. But what's happened is those pain pathways in your body have now been changed, and now they are extra sensitive, and they're sending pain signals that otherwise wouldn't really be pain or would be very low pain. So there are a few different ways that we can develop chronic pain, and one of them is that we have acute pain, say after a surgery or after an injury, that doesn't get relief. And so we're going to see how having a large amount of long-term acute pain will actually change the physiology and turn it into a chronic pain condition. We also see the same thing with neonatal pain. So it used to be thought that, for some reason, that babies didn't feel pain, which I think now we would say is pretty ridiculous. But not only do they feel pain, while their nervous system is so flexible and is learning and creating so many synaptic changes, having significant amounts of pain as a neonate can rewire those pathways, and people who had a lot of pain as babies end up having a much higher degree or much higher risk or frequency for chronic pain conditions as adults. We're also going to see that there are some other types of pain that we're going to look at, such as fibromyalgia, that don't actually come from any acute injury at all, but are completely due to genetics that change the pain processing pathways and environmental stresses that are going to change the way that the body responds to, say, stress hormone and things like that actually change pain transmission and processing as well. So I already told you what acute pain was. Acute pain is something that has to do with an acute injury. So you break your leg and it hurts. Chronic pain, as I said, has to do with the post-injury pain, and usually we consider that to be something 3 months or more after an injury. That pain can be due to a few different things. We're going to talk about neuropathic pain, where we actually have changes to the nerves that are transmitting pain signals, and inflammatory pain, which is a chronic inflammation that just keeps exacerbating itself and keeps going on. Fibromyalgia, as I mentioned, is one of the kind of exceptions in chronic pain conditions in that it's called a central pain syndrome that required no injury. Because all of these types of pain are occurring for different reasons, have different physical reasons for them, they're all going to have different treatments. So acute pain is actually pretty easy to treat. Local anesthetics like lidocaine, it's going to block transmission of acute pain. Opioids, NSAIDs, and acetaminophen are very good at blocking acute pain transmission. So treating acute pain is actually not a problem. We can do that. It's chronic pain disorders that are harder to treat. And so we're going to see that for neuropathic pain, which was the nerve damage, we're going to have some different types of drug classes that are going to affect nerve transmission. In inflammatory pain, of course, we're going to be looking at using drugs that are anti-inflammatories. And in fibromyalgia, we're looking at things that often are going to increase serotonin and norepinephrine. as well as a drug pregabalin. The problem with these chronic pain disorders is that opioids are really not that effective. And that's because we're looking at targets that aren't really mediated through the opioid pathways. So these are the kinds of disorders that had, for the last 15 or 20 years, been treated with long-term opioid agents. And that now we're realizing maybe those opioid agents not only were creating abuse potential, but for a lot of people really weren't helping their pain that much.